Welcome back. Researchers at UConn Health have found a non-surgical treatment to help patients experience TMJ pain. Channel 3's Olivia Schuler explains the clinical trial that seems to be helping.
And it's just gotten worse over the last year or so.
Since Valerie Law was a little girl, she can't remember a time in her life in which she was pain-free.
It was more concentrated back in the jaw area and a lot of clicking. When I talked, sometimes my jaw would just like slide off to the right or the left, depending on which side it was. If I yawned too loud, if I'm wide, if I, had a day where I had to have a lot of presentations or that sort of thing, a lot of talking would just wear it out.
She has always grinded her teeth and had anxiety, but then she had a dental visit where her mouth was forced wide open for several hours.
That was the final straw.
She finally turned to Google in the hopes that the search engine held the answer. She found a clinical trial being offered by UConn Health and started there.
Patients come in and are given an exam. They go through an initial 2-week assessment period. Then they start treatment after that 2 weeks with one of our therapists. The therapy lasts for 6 sessions, typically weekly. And after the 6 weeks, we follow them for another year.
A professor in the School of Dental Medicine says TMJ disorders are often caused by physical stress or trauma. Instead of surgical treatments, patients in the clinical trial go through psychotherapy. Law says after completing the trial, she's able to use the tools given to her to help cope with her pain.
Deep breaths. Bringing awareness to it, taking a minute to kind of back off and analyze your own reactions.
Since completing the trial, Law says her TMJ-related pain has subsided. Lit says about 1 over 2 Americans will complain about TMJ pain. 15% of people's pain will become chronic.
It's been a life changer for me.
Law is now one less person experiencing chronic pain due to the success she found in the trial.
Call the study. I mean, it was a wonderful experience from top to bottom. Just the individual focus and looking at your specific problem and why you're doing what you're doing was really, really helpful.
In Farmington, Olivia Schuler, Channel 3 Eyewitness News.